Welcome to another segment in the Be Informed lecture series. I'm Molly Sugarman, the Clinical Director of the Patient Empowerment Program at Nibra Plastic Surgery in Great Neck, New York. We are delighted that you have joined us today. To facilitate full attention on our presentation, we kindly request that your cameras be turned off and microphones muted. You may type in any questions you have for our speaker in the chat section at the bottom of your screen. At the end of the presentation, I will moderate the questions and we will attempt to address as many as possible. Today's presentation is Living Well Despite Adversity, Inspiration for Finding Renewed Meaning and Joy in Your Life. It is of significant relevance to individuals confronting treatment for a breast cancer diagnosis, genetic mutations, and for women in general. The lecture is being presented by Harriet Cabelly. Harriet is a clinical social worker specializing in loss and grief of all kinds. She has been further trained in positive psychology and logotherapy, therapy of meaning and purpose, Dr. Viktor Frankl, which greatly informs her work. Harriet has a private practice and is a speaker, author, and group facilitator. She is a lifelong learner, welcomes new opportunities and adventures, and wishes she had many lives to live to explore all of her many interests. Specifically, she loves books and the power of words, traveling the world, hiking and being outdoors in nature, and of course, guiding and encouraging people towards living their best life together with their challenges. Please welcome Harriet Cabelly. Thank you so much for joining us today, Harriet.
Hi, thank you so much. What a nice introduction. So the name of the presentation, Living Well Despite Adversity, is actually the name of my book. I'm not sure if you can see it, but it's behind me with the red rose. And just to say, it's a compilation of 36 interviews of people with various challenges, not just cancer, who've overcome and transcended their challenges via all types of coping skills. So I interviewed many of them and presented their stories in hopes and inspiration for others going through their own personal challenges. So speaking of personal challenges, I went through my cancer journey this past summer. Just to reveal, I was diagnosed exactly a year ago with non-Hodgkin's lymphoma out of the blue, as I'm sure most cancer diagnoses seem to come out of the blue. And I was treated at Columbia. I went through 6 rounds of chemo, 5 of them outpatient, 1 inpatient. And with every round, I went through the spinal tap, which wasn't too pleasant, and got through it, although I lost 20 pounds and I'm very small and thin to begin with. So that was very difficult for me. I was very scared that with the weight loss, I wasn't sure how I'd get through it, but I did. And I'm here to speak about it, but not about my personal journey, of course, but it does inform my life at this point, as I'm sure you all know, and all are going through yourselves with your cancer journeys. I came to meeting Molly through Diana of Full Circle Physical Therapy Center in Garden City. When I was at Columbia and I was completing my chemo, I said, they didn't tell me to go to PT. I said, I need to rebuild my body, my muscles, my everything. I want to start physical therapy. And one thing led to another, and other places wouldn't take me. And they said, go to Diana at Full Circle. And when I called, they said, well, we just deal with breast cancer patients. And it was kind of like my husband said, well, whatever. And anyway, she took me. And one thing led to another, and she's great. And it was just a great place. And she connected me with Molly. So that's how I come to you guys, through Diana, through Full Circle. So here we are, full circle. So what am I talking about today? I'm talking about living well through our challenges, living well despite what it is that we're all going through. And being on a cancer journey is something, obviously, to go through. So I have a few bullets I want to touch on. I'm going to speak for the next 25 minutes or whatever. And then, as Molly said, you have a chance to share and ask questions. So 3 main categories I want to speak about is coping skills. And if I look down, it's only because I'm looking at my cards. Coping skills and the growth mindset and meaning and purpose. And as Molly said, I love logotherapy. Logotherapy is the therapy of meaning and purpose discovered by Viktor Frankl. Viktor Frankl was a prominent psychiatrist who went through numerous concentration camps and came out and then wrote this amazing book that I highly recommend. It should be a must read. It's called Man's Search for Meaning. And I've read it numerous times. Each time I read it, I get something else out of it. To me, it's a life-changing book. So let's look at coping skills first. One of the first main ones that I'm going to stress as a therapist is feeling your feelings. Now, when we get the diagnosis, when we're going through it, we're feeling a barrage of feelings, from shock to everything else. And sometimes shock and numbness stays with us throughout. I think I was kind of numb throughout my time, but a lot of us feel all kinds of feelings, and we need to allow ourselves to feel them. We have to give ourselves permission to go through them, because it's only in feeling them and letting ourselves go there can we eventually come through them. The more we push them away and say, oh, I can't feel this, it's too painful, the more it comes at us. I don't know if some of you may know Tony Robbins. Tony Robbins is a famous motivational speaker, and he would speak about fear. And I remember when I attended one of his seminars in Florida years ago, he called someone up from the audience and he did a little dance, and it was the dance of fear. And what was it? You embrace fear. It was like a ballroom dance they did across the floor, holding each other, embracing it, and it was a beautiful visual. The more we push fear away, or any feeling, anger, bitterness, jealousy, upset, the more we push it away, the more it comes knocking at our door because it wants to get in. So we do embrace it. I know it sounds counterintuitive, but we embrace it, we let it come in, and then it softens. It's normal, and we acknowledge it. And there's a beautiful poem I'm going to read to you, but I just want to say, from my positive psychology professor, Tal Ben-Shahar, he also has a great visual. He says, all feelings go through the same pipeline. If we push away and discount the negative feelings, the difficult feelings, then we're also discounting the positives. We can't have one without the other. Human beings are filled with the palette of emotions. We've been bestowed with emotions, both positive and negative, the more pleasant ones and the more difficult ones. And that's what makes us human, and that's what gives us the richness of life. So we allow the feelings. And if I can just read you this poem by Rumi, a Persian philosopher and poet, called The Guest House. Very short, but it says it. This being human is a guest house. Every morning, a new arrival, a joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they're a crowd of sorrows who violently sweep your house empty of the furniture. Still, treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door and invite them in. Be grateful for whatever comes, because each has been sent as a guide from beyond. It's just the idea of allowing them to come in. The statement, be grateful, obviously when we're going through hell, we're not exactly feeling grateful to feel those horrific feelings, but I think you get the concept to allow them. So that's really the number one, and it's very important. Feel your feelings. The next piece I want to say, and there's tons of coping skills. I'm highlighting just a few for the sake of time. The second one that's very, very important, despite the crisis and the hardship, is find bits, and I mean bits of joy, little pieces of enjoyment that we could bring into our day, even when we feel horrible, even when we're going through upset, whether it's our little plants, whether it's a song we're hearing on the radio, whether it's the picture that's in front of us that's hanging on a wall that we could look at differently and glean some joy. Whatever it is, bring it in intentionally, acknowledge it, because we want to feel, and this is hard, and sometimes it takes till a little bit later on. We want to feel, or at least start to think, we are not just a sick patient, although we feel that way. We are not, our whole identity isn't simply our diagnosis and our illness. We are more than that. We are bigger than that. Now, that is, like I said, it's very hard to wrap our head around that one, certainly at the beginning. But hold on to that, because as time goes on, we can embrace that more. When we start to feel a little better, when we start to feel a little stronger, we can say, oh, okay, I'm feeling a little bigger than my illness. But I certainly at the beginning, it's hard. I mean, I couldn't go there at all. But the idea of bringing in, with intention and awareness, little bits of joy. Tiny things can make a big difference in our day. And when we're going through a rough time and a rough journey, we know what it is. It's one day at a time. Sometimes it's 1 hour at a time. Sometimes it's a few minutes at a time to get through certain pain or procedure. But certainly that one day at a time, the motto of AA, it's just, it's a way of encapsulating so that we don't get overwhelmed with anxiety. So find those bits. The next piece, look for and acknowledge pieces of gratitude. And that's also sounds like, wow, I get a diagnosis. What am I grateful for? We look, tiny things, right? We have a roof over our head. We have a good doctor. The nurse was amazing today. I'm in a good hospital. I have healthy food. Whatever it is, it's a huge coping skill. And there are tons of studies that point to the importance of gratitude in coping and in living well. There's an acronym, WWW, and it's not a website. What's working well? And again, in the throes of a crisis, it can feel hard. What's working well? Shit, nothing's working well. But we need to look for those little things that are working well. I'll give you just a quick example, not of this time, but I've gone through other challenges. I have a daughter with disabilities. When my daughter with disabilities had a critical medical crisis and was hospitalized for a year, years ago, I'm remarried, so my kids are from my first husband. So my husband had to be home with my daughter, his stepdaughter, because I was basically living at the hospital at the time for a year on and off. And I remember, because I would write my gratitude journal, 3 things, 3 blessings that we're grateful for. I would write it every day, every night before I went to bed. And the thing I wrote all the time was, I'm so grateful that my husband and my stepdaughter get along, because they were basically living together without me in the house. So we look for whatever pieces, and there's always something. There is always something to find. We could say I spend 10 minutes with my hands wrapped around a delicious mug of coffee today. And that's my piece of gratitude. It's very important, very, very important. So it's finding the bits, and it doesn't have to be big. None of these things have to be big. It's just always have in your head, small makes a big difference in everything. The tiny steps. It's not just about the once a year travel vacation or winning the lottery. It's everyday inputting bits of joy and bits of gratitude. The next piece, monitoring our thoughts. Very, very difficult. When we are intentional about our thoughts, we can manage our anxiety better. Meaning, and it's not easy, definitely it's easier said than done. When we're feeling anxious, what is anxiety? Anxiety is worrying about the future. Regret is the past, anxiety is the future. And what do they say? We need to be in the present. When we focus more on the present, we are less anxious. When we let our mind go, that's when we get into that loop of anxiety. So there's a concrete tip that I remember getting, and I think it's very, very good and helpful. You create a stop sign in your brain, a red stop sign. You picture the sign, the STOP, And when you feel your mind going, like I did after round 4, and I lost over 20 pounds, and it was like, I'm not going to get through this. I may die before I get through this. And what's going to happen? And it was very, very hard. And I actually created a stop sign. I just kind of made something and colored it in red. And every time I would get into that type of tizzy, which is, of course, all future oriented, I would hold it up in front of me and I would take some deep breaths and I would say, right now, I am okay. Right now, I am okay. That became my mantra. Right now, I am okay. And I wouldn't let myself go to the what ifs, for the, oh my God, what if I don't get through it for round 5 or round 6? It's very important that we intentionally monitor our thoughts. There's a funny line, don't believe everything you think. I think Wayne Dyer said that. Don't believe everything you think. Our brains, our minds, not brains, our minds will take us all over the place. We have to rein them in. And that helps minimize anxiety. And anxiety is huge when we're going through treatment. I mean, I don't have to tell you, huge. So being aware, being intentional is very important. Actually, all of these things is really about intentionality, being aware. Now that I want to share with you something I made, and I'm not saying you all have to do this, it just helped me. And if it's an idea that some of you want to, take on, fine. I like quotes and I like pictures. So I made for myself, and I don't know how this came to me at the very beginning, but I made for myself cards where I cut out pictures that I felt were soothing. I love nature. Soothing, and I would put them on a card, and then I would write how am I going to use it? So for instance, this is a picture of me in Zion. Years ago, we did a national parks trip, and I felt this was strong for me because of the mountains. I was small and the mountains were big, which is exactly how I was feeling. I'm small and I'm going through this huge thing. And I put on top embracing strength. And I remember when I got my first lumbar puncture, I took my cards to the hospital. The doctor who did it said, "What is that?" I said, "Oh, I called it then. I didn't know. I said, it's my card, but I called it my coping card." So these became my coping cards. And in the back, I wrote, "My intention is to allow the strength of the mountains to support and embrace me in coping with this difficult process." I just made this up. So I'm just sharing an idea that don't mix. If you think of something and you say, "Oh, just do it." Don't think, "Oh, it's silly. What is it going to do?" Just do it. Because I ended up now, I have over 40 cards. I'll just show you. So I made a sunrise, again, my pictures. You could find them on Google. You could take your own pictures. This is a sunrise. And I wrote here, renewal and hope. And again, in the back, my intention is for the sunrise to support me in hope and optimism to meet a new day. And these were my cards that I made during my whole journey, my whole treatment, I should say. I am now still making them, but this is post-treatment and it's for my own inner healing. And I do want to give you, I'll share one more with you, and then another one later when we talk in a few minutes when we talk about growth. Like a horse with blinders. This became my mantra. That's how I felt. I felt like I was a horse with blinders. A horse has these, and they don't look outside. They just like this. There's no peripheral vision. And for me, that's how it was. I put one foot forward, and I didn't think about too much. And it's interesting because my friends would say, as a therapist, I wasn't talking emotions. I think I was doing a good job of shoving them aside. They weren't haunting me. They just weren't appearing so much. So I wrote, keeping on the straight path, putting one foot in front of the other. I wrote here, my intention is to be grateful for this aspect of myself that has served me well. Again, not for everyone, but for me, that helped me get through it, where I didn't constantly have breakdowns of crying and going into a depression and all that. Afterwards, I think the floodgates opened, but it's almost like during it, I was just like this, like a horse with blinders. So these were things that kind of helped me. So I'm sharing. Okay, so the next thing I want to go into the growth mindset as just a topic. So we went over a little bit of coping skills, and there's a lot more, and you can ask questions. The growth mindset. The growth mindset is actually a psychological concept, and we all know what it means to have a fixed mindset. It's when we were all going into first grade and we took those IQ tests. Maybe some of you were very young and they abolished those. I don't know. But for some of us older people, I think we remember that before first grade, we all had to take IQ tests. And we had that number. That number of our IQ was basically fixed. And you were this, or you were that, or you fell somewhere in between. And that was it. And then it's like, well, I was born this way. Well, I can't help it. This is my makeup. Later on, years later, I think in the 90s, a psychologist from the University of Stanford came up with the concept of the growth mindset. And what is the growth mindset? It is the idea that our abilities are not set in stone. We have plenty of room for growth and change and increasing and utilizing much more of our potential than we think. It is the antithesis of fixed. And what the growth mindset enables us to do is take risks, is to say, I'll try that. I'm not afraid of failing because maybe I'll learn something. Maybe I'll grow. Maybe I'll change. It opens us up to possibilities. We're not shutting ourselves down and limiting ourselves because of that saying that a lot of people fall to is, well, this is how I am. I can't help it. I was born this way. Some of us are more this, some of us are more that. And I want to say, yes, we do come into this world with a certain temperament. We are born genetically predisposed, more of a talent here, more of a talent there. But having said that, that does not preclude growing and getting better at something. Listen, we're not all going to be superstars. I'm not good in technology at all. But if I just said, forget it, I can't do it, I'd never do anything. It's not my forte, but there's a huge learning curve. And I attempt it and I push myself to it. So it's not the idea that we're great at everything, but it's the idea that we can open ourselves up and know, I can always learn. I can be better. I can exert more effort. I can do something I've never done before and try. It's a very enriching philosophy of life. Although Carol Dweck is the person who created this concept, she did it in terms of schooling and putting things into the curriculum that were different, that were helping kids challenge themselves more. So it is a very important concept, the growth mindset, in how we live our lives. And piggybacking on that, I want to give a major quote from Viktor Frankl, who I mentioned before, wrote the book Man's Search for Meaning. And this is, and going with the growth mindset is the idea that what happens to us, we can't necessarily control. But what we can control is how we respond, how we react. That is in our control. So how does that come in with the growth mindset is that some people will say, oh, well, you're just a natural optimist, or I'm a pessimist. I can't do that. I can't help myself be anything other than what I am. No, the idea being that it is in our purview. It is our choice. It is in our control. And we have to feel like we have some controls, especially when we get diagnoses that's out of our control. We have to feel like we have some control. And what is in our control? How we choose to respond to it. Whether we just say, that's it, I'm done, or I'm laying in bed for the next 6 months depressed, or I'm going to do something different about it. So listen to Viktor Frankl's quote, very famous one. Everything can be taken from a man, but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. Now, he wrote this when he was in the concentration camps, but this, again, is the premise and one of the foundational premises of logotherapy. And many people speak of it. It's not just him, but the idea that we are a victim to our circumstances. We are all victimized by getting a cancer diagnosis, 100%. But we don't have to remain in a victim-like mode, because victim modes, or maintaining that mode, it just kills us emotionally. I mean, it just takes away our life because we're just there and everything is befalling us and woe is me. And how do we live like that? And nobody likes to be around people like that. And that's just totally self-defeating. So the choice is not what we're given. It's in how we respond and how we react to what we're given. And that is the choice between victim mentality or not, right? Again, we're victim of our circumstances, but we don't have to maintain the victim mentality. And that hooks into the growth mindset because we are choosing to empower ourselves, and we are deciding, okay, I may not be the world's greatest optimist. I could be in general more of a pessimistic person, but I could build myself a fraction. I don't have to go from 0 or 1 to 10. I can go from 1 to 1.5. And again, keep in mind, tiny things, tiny steps make big differences. So if we bump ourselves up from, let's say, a 1 to a 1.5, we're already better. Not compared to the next person. We don't compare ourselves to others. We compare ourselves to ourselves. So if I'm by nature, and I say, wait a second, this isn't serving me well. I want to input certain things that will help me be a wee bit more whatever, more optimistic, more happy. I don't want to use the word happy per se, but you know what I mean? We bump a little bit. And the word, I'm not going to hone in on this word much, but the word resilience, it is now in a lot of schools' curriculum because it has been shown that resilience, again, is not something we're born with. Yes, some of us are more prone to being resilient than others, but it is a skill. It is a skill set that can be taught and can be learned. Okay, so it's not going from a 1 to 10. Don't look at it like that. It's going from a 1 to 2. I could grow my resilience muscle. Just like when I go to a gym, I grow my muscles. Resiliency is a muscle. We can grow it. Just like optimism or anything else. And that's the piece that hooks into the growth mindset. If you buy into the idea that, yes, we're not all fixed, we're in a growing phase as long as we're on this side of the earth, then all of these other things fall into place. Then yes, I can grow my joy, I can grow my gratitude, I can grow my resilience, I can grow my optimism, I can grow myself to enrich my life. And the last piece I want to address is meaning and purpose. So again, not to belabor the point, but logotherapy is the therapy of meaning and purpose. So when we are going through a crisis, such as cancer, we're in the throes of it. We're not thinking about meaning and purpose. We're thinking about how am I getting through every day, every hour? How am I getting through this? When we come through it, God willing, we come through it, we start to hopefully feel a little better and start to reflect and think and say, look what I was given. Look what happened to me. Is there something I can do with this? Now, not everyone thinks like this, and that's okay. And sometimes a few years later, we could start to kind of reflect on this. Doesn't have to happen right away. And some people do go back to life as it was, and that's fine too. There's no one way. But more often than not, people will say something came of it. There's a renewal. There's a something, even if we can't articulate it right away. So I want to put out the concept, and maybe some of you, or all of you have heard of it. It's called post-traumatic growth. You've heard of post-traumatic stress, of course. This is post-traumatic growth, which was also coined in the 1990s by two professors in the University of Carolina. And it is the idea that out of a trauma, challenge, whatever word you want to use, can come growth. And there are 5 categories of this. I'll just say what they are. I'm not going to get too technical, but it's personal strength, appreciation for life, new possibilities, spiritual change, and relationships with others. Meaning, those are the 5 categories that have been studied where after people come through major crises, and again, it's not right away, it could be much later on, things take on a new meaning. Things become enriched. You know how oftentimes people will say, specifically after going through cancer, they'll say, wow, I'm now appreciating the sunrise. I'm now appreciating my morning coffee more. I never felt so alive. There's a lot of times people will say that. That's what this is. It's that renewal. It's that vivra. It's feeling like, wow, I've been given a gift of life. I'm grabbing at it more. And the next piece of that is, what am I going to do with it? If we go there, again, not everyone goes there. Some people are perfectly happy picking up the pieces and going back to where they were before, and that's fine. But in general, we are more, as humans, just like plants, we grow towards the sun. We grow with our challenges. We don't step back into how it was. Even if we don't feel it yet or can't articulate it, there is growth. So I invite you to kind of note and see where is this feeling stronger for you? Is that feeling, do you have more of a belief? Do you have more of a connection? Do you feel more grateful? Do you feel more challenged to say, wow, I want to live better. I'm going to start doing more. You know, people create their bucket lists. These are all different ways to engage in life differently than before. And that's growth, right? That's growth and change. And that brings out more of us. So I'm going to stop. I don't know how long I've been talking, but I could keep going. I want to give time for comments. I just want to end my part with one quote by Tal Ben-Shahar, positive psychology professor at Harvard. He writes, things do not necessarily happen for the best, but I can choose to make the best of things that happen. I love that quote. I'm going to say it again. Things do not necessarily happen for the best, right? Cancer doesn't happen for the best, but I can choose to make the best of things that happen. I guess it's a little bit like finding the silver lining, but we're not going to be Pollyanna-ish and go like, wow, this is just great. Some people might. I don't like to say it like that because sometimes it's offensive to others, but I think this line says it in a way that's more palatable. So anyway, thank you for this time for me to blah, blah, blah. And can we open it up, Molly?
Surely. Oh my gosh, you really tapped into the tenets of the patient empowerment program, which is based on post-traumatic growth.
Mm-hmm.
And it's something that certainly I try to foster through the various tools that are offered. And I've seen incredible changes. And yes, some people choose to return to the way they lived previously, but the bottom line is that you go through this challenge, no matter what your diagnosis is, and it changes your story. It's
Yes.
a chapter that certainly alters the fiber of your story, and you don't move on from it, you move forward with it. And
Beautiful. I love that.
how you incorporate that into your life is a very personal thing. At this time, if anyone would like to ask or Harriet any questions or would like to make any comments, please put them into the chat section below. You may not, and you may just be digesting all of this. It was truly extraordinary, Harriet.
Thank you. There's a lot here, so I was trying to get it in.
Well, it was spectacular. I caught myself writing down a lot of your quotes and certainly want to follow up with some of the things that you discussed. But tenacity and I think I would add to the resilience, tenacity, the tenacity of the human spirit. That we are confronted in life by various stressors and you can call them challenges, traumas, stressors, and the human spirit has a certain tenacity that you can tap into and a certain sense of resiliency that buoys us forward.
Yes.
In that regard.
Yes. I like that word. Thank you. I'm writing it down. Yeah.
But I want to extend our appreciation to you, Harriet, for that extraordinary presentation. You also mentioned something that we talk about very frequently, and that was being in the moment. And how do you deal with your head going on fast forward? I have a phrase that people call a Mollyism of, what do I know to be true at this moment? Which is a very simple cognitive behavioral technique that many of the patients have begun to employ in their life, that helps them that assists them in grounding them at a time when they feel like they're spiraling. So one person just asked, this is not a question, just something my mom always told me. We worry about things that don't even happen. Our mind is a dangerous tool sometimes. Harriet, you are delightful and so helpful. I totally agree. I think that's Joanne who was saying that.
Thank you. Thank
That's
you. But it's
extraordinary.
true. We worry. What do they say? You know, half the time, whatever you're worried about, it's something else that happens. And then we waste our worry.
Exactly. And that takes a lot of energy. That worry is exhausting.
Yeah.
It's as exhausting as anything that we might do physically.
Right. And that's why it's so important to put the brakes on. I call, the brakes, that stop sign.
Yes.
Because otherwise it'll run and we'll run with it.
And that stop sign is the same thing as, what do I know to be true at this moment? It puts a halt on examining, what do I know at this given moment?
Right.
And trying to embrace that. And yes, that's easier said than done. But there are tools out that one can employ.
Definitely.
So thank you again. I hope you'll come back in the future, and so that we can tap into your knowledge and to your insights. It was truly extraordinary.